Hey everybody, this is Dr. Tim Dunn. I'm up in Johnson City. There's a technique that we use in our practice that I would like to be able to offer to the rest of the chiropractors out there. It's called Thoracic Pump. When you stimulate the nervous system with a C1 adjustment, as you all know, it increases immune response by 200%. But what about the chest congestion? This is where the viruses get us and pneumonia and those types of things. This, along with the adjustment, is exactly why the drugless institutions and the Spanish flu pandemic in 1918 were to have such high success. Okay? So precautions: dentures, gum, food or choking, anything in the patient's mouth. We want to make sure that there's nothing that can be drawn back into the throat for choking. That's the first precaution. The second, patient's age, their bone density, medical conditions such as a pacemaker. Yeah, pacemaker, if they've had an open heart surgery, you may have some chicken wire to worry about, those types of things. Fair enough? So we want to look at anything that could get caught in the throat, and is there anything medically, such as decreased bone density, such as pacemaker, such as history of open heart, that would change how we apply our hands to the chest of the patient. Preparation: we're going to go to the manubrosternal joint. If you come to the sternal notch, you come down 1.5 inches. That's the manubrosternal joint. That goes mid-palm. Your palms are on, your fingers are facing down on the patient, inferior. The vector, and I'm going to show you a video on how to perform this, but you're at the head of the table. I'm right-handed, so my left leg is forward. I'm going to place my right hand on the manubrosternal joint, and you remember, docs, the ribs are going to come up like a hinge. So what we're going to do is, as we apply pressure, we're taking the hinge down. So again, arm vector, arm angle, breathing. We're going to review that when we do it. Provider stability. You can't be at the head of the table, because when you push off on the patient to get your hands back, you're going to end up pushing, and you don't want to do that. You want to be in a position to retract your hands the same way we do as when we adjust patients, toggle, recoil, those types of maneuvers. Provider stability. Provider timing. And this is when you're looking at the patient breathing, and we're going to review that for you guys. You're going to repeat this thoracic pump 3 times. 1, 2, 3, and then you can repeat it multiple times throughout the day. So my patients that have any upper respiratory types of issues, they get a thoracic pump, whether it's the flu, coronavirus, whatever it is that's going on. If they have upper respiratory, sinusitis, those types of things, they get a thoracic pump with their normal adjustment. You want to hear a snort. When you get off of the patient very quickly, it's going to create that negative pressure in their chest cavity, and that will produce a snort. That's confirmation that you created a negative back pressure, thereby popping open the lymphatic tubules and draining the fluid or infection out of the chest cavity. That's the goal. And that tells us that we have success. Now we're going to grab a patient, we're going to go in on the table, and I'm going to talk my way through it, and hopefully this helps you. It gives you another tool in your bag to fight not only the flu, but this time of year with this virus. So one of the first things that we do is we make sure that the patient has nothing in their mouth, such as candy, gum, anything that can go down the windpipe, the trachea. If they're older patients, then we're concerned about dentures as well. From a structural standpoint, if the patient has a pacemaker, they're going to put the pacemaker just below the clavicle, typically left side, upper pec. So we need to know about that. If they've had an open heart surgery, then we need to know that because of the chicken wire. So let me review with you, doctors, just a real quick way. If they've had open heart surgery, how do you place your hands? So again, it's a little more difficult with ladies. So we'd have ladies cover themselves, right? But we're going to put our hands on top of theirs. So take a deep breath in and let it out. And then you're going to take the rib cage down. This way, the patient's covered, we're covered as well. Fair enough? So that's in case you've got bone density issues, if you've got prior history of open heart surgery with a chicken wire, or if you have the pacemaker. That's the first thing. So the goal of what we're trying to do is to create a negative pressure in the thoracic cavity. And we're going to do that by using the body's own biomechanics. I'm right-handed, so I'm going to stand on the patient's left, and I'm going to use a wide stance. That way I can work with the patient and I can get my hands off very quickly, yet I'm not pushing off the patient. If I have my hands on the patient's chest and I'm wanting to retract, your initial reaction is going to be to lean into them to pull your hands back. And that's exactly what you don't want to do. So we're going to get a nice stance this way. That way, no matter what I do, I can use my hands, which is what we do as chiropractors, like with a toggle, something like that. So we're going to put her hands down. You're going to come up to the sternal notch, which is the very top of the rib cage, the thorax. And then from the top of the thorax, you want to go into the manubrium, which is the first bone that comes down. It's about 1.5 inches long. And you're going to have the manubriosternal joint, because here I have the manubrium, and then the other piece coming down about 3.5 inches long is the sternum. So that manubriosternal joint is about 3/4 of an inch wide, and you're going to put it mid-palm. So once I apply my hand mid-palm on the manubriosternal joint, the vector of your arm is going to be in contrast to the ribs. And the ribs are going to form like a bucket handle, and the bucket handle is going to be off the spine. So the goal is when they take a deep breath in, you come up with your hand. As they exhale, you push your hands down and you hold. Then the patient inhales again, which is going to be an abdominal breath. As they exhale, you go down just a little further, holding. The third deep breath, when they take a deep breath in, just as they're starting to inhale and the abdomen rises, you quickly retract your hands. This allows the ribs to rapidly fire back into position, and that will create the negative pressure in the lung cavity, in the thorax. In doing so, the patient will take a very sharp and crisp breath of air in, and hopefully they snort. If they snort, or a sound like that, that's confirmation that we have achieved the negative thorax pressure. So, this is what it looks like. You instruct the patient, we're going to take 3 deep breaths in a row. Deep breath in, and let it out. And we take the ribs down. And hold. Deep breath in, holding ribs, and exhale. Take it down. Third one, deep breath in. And when you get off very quickly, you heard her gasp for air. That's what we need to hear. We need to do this 3 times in a row. So let's repeat that again. Deep breath. Let it out. Deep breath in. Let it out. Follow the ribs down. Deep breath in. And that's the noise that we want to hear. We want to hear that gasp. We're going to do that 3 times in a row. And this can be done multiple times throughout the day, guys. Multiple times. So if your family member is having an upper respiratory, viral, bacterial, if it's an upper respiratory, thoracic pump them multiple times a day, much the same as we as chiropractors are adjusting the atlas to relieve brainstem pressure and stimulate the stimulate the immune response by about 200%. That's the thoracic pump. Again, let's recap. Precautions are anything in the mouth and anything pertaining to the ribs, such as open heart, pacemaker, those types of things. Bone brittleness as well. If you suspect someone is older with bone brittleness, have them cross their hands, use their hands to push down. And again, same way. You're in this position, cross your hands. Take a deep breath in and let it out. Push your hands down, deep breath in, and you get off quickly. And you want to hear that gulp of air or that snort of air. So that's how you can disperse the stress of pushing down on the chest. Again, same as an adjustment, multiple times throughout the day. This combination of a thoracic pump with an upper cervical adjustment is exactly why 100 years ago they were so successful in a drugless facility. So if you guys have questions, instant message me. I can answer things by video. Let's get after our patients with the adjustment with the thoracic pump. I hope this helps. If you got any questions, guys, let me know.